Hey guys, this is my knee thigh exercise. This is something that I have learned from my preceptors here at Penn State, and I think it's a really helpful early on exercise to include. So it's called a lunge matrix. We typically uh, use this for a lot of guys with quad contusions, hamstring strains, sometimes for guys with ankle injuries and they're having problems with weight bearing. This is a good introduction into weight bearing and loading through the lower extremities. So I'm going to flip to the actual video I recorded to show you guys how that works. It is a forward lunge, a 45-degree lunge, a lateral lunge, a 135-degree lunge, which is, if you're thinking of this way, it's going here. Where your plant foot is planted and you're trying to rotate your hip backwards, and then you have a backwards lunge. And we typically do that for both sides just to be even. We're really only doing that on one side if there is no obvious strength difference between the two sides. So with the lunge matrix, this is typically a very early on exercise, as long as guys are functional and weight bearing. So this is sort of a combination of range of motion and strength because you're doing lunges in different planes, but it's just a body weight strength exercise. Typically, we'll just do this 3 or 4 times through on both sides. Um, Progression of this exercise, you could incorporate banded resistance for knee valgus and knee varus. We've done that for a couple guys with LCL or MCL sprains, and they've responded well to that. You could also have cuff weights around the ankles to do that, provide a little extra resistance with the actual moving of your foot to go into a lunge. And typically for those, we'll only do that about 2 or 3 times through, just because there's more resistance to that, so we don't want to go too hard on that. This isn't really an exercise that you regress. It's a pretty base level exercise, but if you're able to have some sort of hand on a table or something to support, you can have an assisted lunge matrix if you need that. We typically discontinue this exercise once an athlete is able to go through the full matrix without having any pain or difficulty. Particularly with difficulty, sometimes we'll push through pain a little bit, but once they're able to get through this, we'll switch to more plyometric lunge type loading, so lunging with a kick or kind of jackknifing, whatever you call it, where you're jumping and switching your loading foot. So yeah, hope this helps.